everyone. Thank you for joining us today for our webinar, The Future of Skin Rejuvenation from Fillers to Regenerative Aesthetics. I'm Ronnie Glass, Director of Marketing and Education at Nanopass Technologies, and I will be the moderator tonight. Today's session will dive into regenerative aesthetics, exploring the latest insights and practical takeaways that can help you in your practice. I'm honored to introduce our guest speaker, Dr. Daniele Bollero, plastic surgeon from Italy. Dr. Bollero is a specialist in reconstructive and aesthetic plastic surgery and currently serves as Senior Medical Officer at the Plastic Surgery and Burn Unit of CTO Hospital in Torino, Italy. Dr. Bollero has led numerous humanitarian surgical missions worldwide and has published extensively in the fields of regenerative medicine, scar revision, and aesthetics surgery. Before we start, a couple of quick notes. This session is being recorded and will be shared afterward. Feel free to submit your question in the Q&A box at any time. We will address the question at the end of the presentation. Please stay until the end for a short warm-up and key takeaways. And short disclaimer, this webinar is organized by the company, Nanopass Technologies. The views, opinions, and recommendations are solely those of the lecturer and do not necessarily represent the official position of the company. And now, Dr. Bollero, the stage is yours.
Thank you very much, Ronnie. I'm going to share share my screen in a second. Okay. Okay, I have to go up. Okay. So my cheek are a little bit red after the presentation introduction of Ronnie. I'm a plastic surgeon from Torino, Italy. I'm very proud of this invitation that permits me to focus the actual position of the future of skin rejuvenation.
Dr. Bollero,
yes,
please share on the entire screen.
Sorry.
Thank you.
Okay. So I want to thank the company for the invitation for this talk. And I think that every talk has to start with questions. Why we are here? Thank you for all the colleagues that are now online in different parts of the world. And it's important to start with the question why we have to discuss about the future of skin rejuvenation. Because our patients are completely changed. Now in Italy we have patients with a lot of expectations, but also with a lot of doubts of confusion. So 7 p.m. in Italy is like the end of my outpatient clinic. And today I've seen many patients that came up even at 60 for the first time to a plastic surgeon, to a cosmetic doctor. And they are little bit confused about all the offers that are on the market. So I have written this book that is just recently out about my way of doing cosmetic medicine, and the patient is like a guide for them. And the patient like this because they like to be involved. That's why also their expectations are evolving because they want to be informed. They are looking for new products, and that's why they were very curious for all new tools that are on the market. But also they want to have a scientific part behind. They want to know what there is behind. And as a plastic surgeon, I have to admit that even in Italy, if I propose them to go directly to a facelift, they say, no, I want to do a less invasive procedure. I prefer to start with cosmetic medicine because everyone has his own life and they don't want to have like part of their life stopped by the surgery. So we are still doing a lot of surgery, but cosmetic medicine for sure is growing. So also the age of the patient that are referring to us is growing. So these are pictures that the patients send us to WhatsApp, and they say that is in Italian, but say, I'm 66 and I feel younger. Thank you, Dr. Bollero, for your help, for helping me for natural and long-lasting results. So this is why we are moving from correction of the volume of the wrinkle to a concept of regeneration of the tissue. And you know, I started my career with the rise of cosmetic medicine. So I've seen all these years the growing of this field, and in the beginning of the 21st century there was concept of filling, correction of everything and things like that. Last decades we are speaking about harmonization, profiling the face. And now it's time of biostimulation and regeneration. Why? Because there are already some patients full of fillers, and so you have to change your strategy with them, not to overfill them, but to work on them as biostimulation, as regeneration. As you all know about the collagen biostimulator, it's not only volume, it's just to regenerate the tissue. And so these are three that are very popular here in Italy, but in all the world, like polylactic acid, like calcium hydroxyapatite, polycaprolactone. These are products that we can use in different way as collagen biostimulators. But also PRP and polynucleotides, that are the topic of my presentation tonight, are very important from superficial rejuvenation of the tissue. So it's not just a question of volume, because you have to restore your tissue, you have to give freshness to the tissue. And so this is a biological stuff that you can conduct through these two products. And this strategy using PRP or polynucleotides, I think it's easier for patients that wants natural, gradual, safe rejuvenation. You know, they came inside the protocol, so it's these products are very important for patients that want to stay in your office, want to pass your part of their time in your office. So I think that this is a new concept also of cosmetic medicine, in which the patient could stay in your office and come for different treatments. And so it's important to start from the idea to reactivate what the skin already has inside. So starting to feed your skin. And the new focus is on collagen, is on reproducing elastin, is hydratation of the skin. And this will create a long-term skin quality, very good. That is the key for also for the happiness of our patient. About the PRP, I don't know if you already have this experience with DRP. We do a lot of PRP. In Italy, you can use in your office, but you need to have some authorization from the blood bank. We have I had this authorization 10 years ago. So my experience is very huge in terms of patients. And as you all know from this paper that are easily possible to find, practically the platelets are natural sources of growth factor and cytokines. So the idea is to have something that could work to enhance the quality of your skin. But this can use in different part of skin, because in a normal skin, you can work on skin laxity, we will see later, in aging. But PRP, in my experience, is very useful for scar. And as I think you already know, in eye restoration, as you see in this patient, in which I think there are these surprising results if you do correctly the protocol of PRP. But when you start every new procedure or you have to explain to the patient, even in Italy, they are all concerned about contraindication. With this procedure is very natural, and so all the contraindications are very, very little and not so important. And so, you know, there are not many patients that can go out from this group. Another important point are the side effects connected to the treatment, but the side effects of PRP are not usually important because PRP, you know, is an autologous product. And the normal problem that you can have are related to the injection, no? The swelling, the rending, the browsing, the tightening of the skin. And so, you know, it's a procedure that you can do without any big problems. Sometimes it's also important to understand if there are some patients that could not respond properly to the PRP. In Italy, we asked them to arrive for the first time with a blood account in order to see the number of platelets that they have. This is the best way, but you know, you can read here in some situation in which you can have less platelets in the patient. But when I started to use the PRP for cosmetic purposes, I was curious due to this United States procedure. It came from United States, I think, 15 years ago. And they started to speak about vampire facelifts. To be honest, in Italy, the translation is not so easy, is not so accepted, because vampire is connected as a negative animal. And so I don't like to propose them as a vampire facelift. But just to know that for United States, vampire, according to their custom, their habits, for sure, it's a way to propose this kind of procedure. When you have done your blood harvesting, you prepare the PRP, and then you can inject it in the area that you choose, the scar, the face, or the hair, the scalp. And you can do this injection. There are a lot of injections with small needles. And we are coming to the point. And the growth factor that are in the platelets are going to stimulate the cellular mechanism, given the proliferation of the fibroblasts, given the synthesis of collagen, and also creating like an inflammation. So there will be more vascular vessel in the skin. As you can see here, there are some data in which it's also important for wound healing, because you can even use for skin ulcers or for wounds or for trauma wounds. There are a lot of papers that display the role of PRP for this situation. Again, you can see what happens when you have a skin regeneration. We are going to boost the production of hyaluronic acid, the collagen, and elastin. This permits to have a better quality of your skin, a firmness of your skin, and so you have a really skin regeneration. This is important because this is the way you could propose to the patient. And so this was one of my first vampire lift protocol, and this is the protocol that I still use, and this a protocol that is based on 3 sessions. The first one is intradermal PRP, then after 1 month again intradermal PRP, and the second month intradermal PRP. So there are three sessions. Normally we tell the patient that she has to wait 2 or 3 months to see the real result. So this the picture that you see on the right of the screen is a 6-month follow-up. But when you start, you try to understand which is the best injection technique that you can use. Linear treating, I prefer micro-whiz like an Apache, creating 1 centimeter of distance from one to from the other, possible to work in a fan mode or cross-section. So there are different description of the use of PRP. As I told you, I prefer the micro wheels. About the result of PRP, 3 weeks, after 3 weeks, you start to see some results, but you have to wait at the end of the protocol and to see the final result of the new skin or the improvement of the scar or the regrowth of your hair. So what happened? The patient asked more. Okay, I want to do not 3, I want to do the first, I want to do the 5th. And I say, okay, it's up to you, but I prefer to wait 6, 8 months to do another group of treatment of 3. Again, about the risks are very little because it's an autologous preparation. I think you have to protect yourself to put who is going to prepare. It's a blood, so you have to be protected. In Italy, we use closed systems that are authorized by the blood bank. And also, when you inject it, we work with the glasses to protect ourselves to the risk of transmission or with all the blood samples. So after 10 years of PRP, I think that I'm very happy about the protocol that we have prepared. We are doing a lot of PRP sessions because it's not so expensive. It's autologous, and you can use it easily. And if you correctly prepare your staff and the organization of all the procedure, it takes 30 minutes from the entrance of the patient to his or her exit. And also, I think it's important that this procedure can be done all the years because, you are coming from all parts of the world, but instead in Italy, there are different seasons and some type of protocols we can use in summer because there is a lot of sun. Instead, we can use in winter, even in the summertime. So I give you again I think Ronnie has to tell something, no?
Yes. Okay. Now we have a quick poll time. Please click the poll button on the button toolbar vote. If you don't see it, I will submit it right now. If you don't see it, so click the 3 dots and choose a poll. It's open, and please, we would like you to answer it. Okay, we give you 10 more seconds. Okay, thank you everyone for answering the poll. Dr. Bollero, you can continue.
Okay, of course you can write all your questions already because we have finished the PRP part. You know, I don't want to be boring with you, but because PRP is is a very big field, but just to start to know what there is about the regeneration medicine. The second part of regeneration, because you know, the first part is that PRP we can use for instance, on a patient that want to be to have a biostimulation of the face of the neck in the same session. Instead, in some patients that want just small areas, like barcode, like the lower eyelid, we use polynucleotides. Polynucleotides are a new product that came in Italy with these purposes. These are chains of nucleotides, the binding blocks of DNA and RNA, and they are derived by natural sources like salmon. The key action of the polynucleotides are the same as you have seen for PRP, because can do hydratation, has an antioxidant activity, can give tissue repair and biostimulation. I think the big difference is the possibility to cover wider area with PRP instead with polynucleotides, smaller area, because the syringe are 2 ml. Instead, with PRP, we can have 9 ml of PRP. So the goal of polynucleotides is, as we have seen for regenerative medicine, to restore the skin quality, stimulating fibroblasts, and improving the matrix, extracellular matrix integrity. So what happened? As you have seen for PRP, we have fibroblast activation, and then again, production of collagen, production of elastin, production, the same things as we have seen for PRP. And also, you can have a cellular protection, because there is also a part of oxidative, like working, reducing the oxidative stress, and a part of tissue regeneration. There are also in this, with polynucleotides, there are some experience also for wounds, for skin ulcer. You know, the things that, due the fact that are in the same fields, the regenerative part of these polynucleotides are very important and should be explored in the future. So there are also some recent paper in which it's clearly written that polynucleotides has been shown to have anti-inflammatory and antioxidant properties, and so they enter in this field of skin rejuvenation treatments. My clinical application I use for skin revitalization, mainly in areas that are tricky area, like as you see in this picture, eyelids, barcode, and things like that. Stretch marks, you can use it, acne scar, rejuvenation, as I told you, pre- and post laser and peeling, and there are some experience with genital rejuvenation. I don't have any experience on that. So the protocol is a protocol of 3-4 sessions every 15, 21 days. And then there is the maintenance, but it's the patient that normally are the patient that ask, I like this result, I would like to have more. I say, no, okay, you do your session, then you wait a little bit, and then you come back after 3 or 6 months, up to you, or your clinical condition. Again, it's a safer procedure. It's a natural approach to skin regeneration. So we are speaking about PRP, we are speaking about polynucleotides, but now it's time to start to speak in which way we are going to deliver this kind of regeneration. We can use microinjection, we can use needles, we can use cannula. I think that every one of you that are expert doctors have, you already have your own ideas. But if we are speaking about PRP or polynucleotides, we are saying that they don't have any adverse effect, but there are some adverse effects to this procedure that are mainly the fears of injection. Because these are procedures in which we have to give to the patient a lot of little injection. So according to the literature, you can see that the 10% of our patients have a fear of injection. And so this is important because sometimes they stop to do cosmetic medicine due to this fear. So we have to work on that. We have to work on that, and some paper explain this pain, this needle phobia, as a problem, as a contraindication for the treatment. So you can see from this paper that this impression rate of patient, 58-65% of adults won't consume aesthetic treatment due to the fear from pain, injection, and side effect. This is what happens every day in Italy, because every day I have 2-3 patients that have never done nothing of cosmetic medicine. They arrive and say, okay, I'm feared. I'm afraid to have pain to the injection. I'm afraid for the browsing. And so we have to think about that, because it's not the product, it's what we can offer to the patient. And this is a patient of mine. I've done to her a lot of treatment. She was very constant patient. And once I've done, you see this browsing, and I've done biostimulation. And the story was that she had a surgical operation 10 days before. And so she has done some anticoagulants for sure. She doesn't know, but for sure something happened. And all this browsing create a complete disaffection to this patient to me. And so she disappeared. And this is a thing that you have to think about, because if you browse the patient, you will lose them. And I think that they see this situation that could be also a normal situation. They see this as your fault, not as a problem that could happen. They see they think that you have done something wrong if they have this browsing. And also about browsing, you have to think about that there are a lot of anticoagulated patients. In Italy, aspirin is very common for a lot of patients. And we, even in surgery, we won't stop aspirin before surgery. And so when you have a patient with aspirin, what do you do? Can you do PRP? Can you do polynucleotides? Because you are going to do a lot of injection to this patient. So do you take the risk to have a lot of browsing? And how will you manage these patients? And so started the big story of finer needles that can reduce pain. And I tried all kinds of needles. You can see two needles that I use constantly in my practice. Invisible needles are very popular because they say that are very thin, and 30 G per millimeter. I use a lot of in air treatment, and so I try everything to reduce the pain. And I study all the things that I can do to reduce the pain to the patient. And so you have also to understand the injection pressure force during the application may affect the patient perception. So when you are at the end of the day, your hand become more hard, And so you have to think about also about that. So we use some pen that can help us to do this multiple injection, just to think what we can offer to the patient to reduce all kind of discomfort that we can give to the patient. So I'm looking always in my history to every kind of revolution that came in our market, and you know, it's difficult. It's difficult because every evolution it's a revolution, and when I'm a curious guy, I'm a curious doctor, so I want to understand more. And when I was in Stockholm, in the Nobel Museum, I've seen this sentence. This is my picture. That's why it's not correctly positioned. And this is the story of many things that I have, many tools that I have in my story as a doctor, as a plastic surgeon. Because at the beginning, the people say that is in conflict with the Bible. I remember, just to tell you something different, that when negative pressure arrives in the market, I was one of the first doctor 25 years ago to use negative pressure on the wounds, and so there was a great debate against negative pressure, and now then there was a period in which they say, okay, but it was easy, I've done it before, and now negative pressure, everyone knows what is this as a plastic surgeon, and there are a lot of examples like this in which now everyone believes on this. And this is a funny story because, you know, when I read this sentence of Louis Agassiz, I remember when I was a young doctor and I was starting with with a lot of enthusiasm with negative pressure, and now all the doctors say that is normal, but that time was not normal. And so in this situation, the new change is that we have to forget the needle, the name needle, okay? Because I was spoken about spoken about the invisible needle, short needle, and things like that. We are not speaking anymore about needle, but we are speaking about something that help you to deliver PRP or polynucleotide inside the superficial part of the skin. So this is called intradermal delivery. And these intradermal delivery devices are very, very interesting because it's a new concept. There is a cure, there is a learning curve to use it then, not so big, but it's a new way to work on them, with them. And they are very precise. There is a blue line that you have to follow to correctly enter a 45 degrees, but there will be some video to show this. And these are pure silicon crystal, the tip are pure silicon crystal, and they can be mounted on any syringe that you can have already, you can have in your office. So they are shorter than any aesthetic needle, and you know, I think that you need a Luer lock syringe, and then they are 37 more shorter than a standard needle. This is the big revolution in which there are two kinds of needles that you can have it, 800 micron, and 600 micron. You know, you can see, you can read on the slide that 800 is like, can pass through what can pass through this 27 and 28 gauge. Instead, the 600 are product, can pass through product equivalent to a 30, 31 gauge flow. That's why we are speaking about PRP and polynucleotides, because they are very liquid products that can pass through easily through, for instance, the 600 needle. There is also, you know, at the beginning when we are speaking about fillers, when we do courses, we say, okay, you have to be intradermal with the fillers, but it's not so easy to go intradermal with a single needle, with the needle, because sometimes you could go easily deep. And so that's why the MicronJet needles can go really inside the epidermis and the superficial dermis. And as I already said, 70% of intradermal injection are administered in the hypodermis. This is the paper that describes this. And this is a normal situation that we have with the filler, because you try to be intradermal, but you go a little bit deeper and you go in the subcutaneous tissue. And so it's important when you want to go instead in the dermis to have something that you are sure that can reach the dermis. And this is created by the length of the needle that can reach the dermis. And there are some wonderful pictures that you can see here in which you see how can reach the dermis. So what happened is that you create little bubbles on the skin, and they are going to disappear very, very quickly on the patient, but you are correctly in the right place. Again, we were speaking about the problem of browsing in these multiple injection procedures. Browsing with this needle, you don't reach a part of dermis full of vessels. So you are able to work in a portion of the skin in which it's quite impossible to create any browsing. And this is not only my opinion, but also Dr. Shinobai Aguilera has shared with us his experience with this needle. And I think this is another important issue to be underlined. When I use this patient, anticoagulated patient, my first choice. She's a patient of 72 years old. She's very demanding. She came to my office and said, okay, I want the threads. I want to restore my face a little bit. I don't want to match. I want to have a session of threads. Okay, so but you do take a very important like warfarin anticoagulant, so I cannot do nothing. I can do the laser. I can do because instead it's important to explain that you will have a browsing for a long time. So I convinced her to start with this needle, and now she's very, very happy about the result and the procedure, because this procedure does not create any downtime to her in her normal life. Everyone has his own life, many activities, to go to the theater, to go to the cinema, and they don't want to deal with the browsing. So there are also some publications that you can check. I've seen that perhaps there are some questions. We are going to finish, and then we are going to answer to all the questions. So there are some more information that you can find directly to the website of the nanopass.com, in which the doctors are happy with this use. You have to properly choose the device, the product to use with, but I think that's important to see how the patient reacts to these needles. You have to explain them that you change the way, because it's a completely change, it's a completely different way, because they have a different situation. When we started our, for sure, when we started our first courses with the needle, you remember that all the doctor told you that after a while, after some injection, the needle is going to break a little bit, and so you have to change the needle for a while. It's very interesting that if you want, after 50 injection, it doesn't change. MicronJet doesn't change. This is important because how many injection do you do if you do a PRP? More or less 50, because if you do all the face and the neck, you are going to put 50 micro bulla in the face, and so that's why it's important that the product, the intradermal delivery device will not change its capability to enter in the skin. There is also another important thing that I want to underline that is not written, that using the MicronJet, you are also creating biostimulation, mechanic biostimulation, like kind of micro needling together with the product. That's why you have a double effect: your product plus the injection reaction with all. But there is a lot of story of the micro needling in the dermis, in which you create more collagen, just only creating only with the microneedling. So, you know, I think that this webinar is just to tell you my story, because, you know, I don't have to speak about all the clinical studies that are still present. You can, there are also, one is on the left from Alberto Diastro, is a close friend of mine that he used from botulinum toxin. Is from Torino too, and you know, all these papers, these are Italian papers too, from anche Roberto Dell'Avanzato, also Roberto Dell'Avanzato, another friend. And so I think that there are a lot of publications already on these needles, but I want to give you my experience. That's, I think, the focus of a situation like this. I'm going to finish soon because I want to speak a little bit to answer your question, and other papers. The story starts from the vaccines, and so the sort of this intradermal delivery device started from the vaccines, and so you see that there is a lot of satisfaction even for the children. And I want to take you to my office to show you the procedure. So I'm going to skip a little bit to go directly to the video that show you how I use them. You can read this, but you know, as I told you, I think that if you didn't try, give your experience. Remember, there is a learning curve, because at the beginning you have to find the right way to enter in the skin. At the end, there are also some already some papers published about this experience even in the United States. But this is my office, and I hope you can hear.
Welcome to my office. Today we are doing an improvement of the skin quality of this patient. She's very constant, and during this year we have done cycles of PRP. This is another session, and we already have prepared the PRP here, and we are ready to inject. The idea is to insert the PRP very superficially in order to improve the quality of the skin. So I choose the MicronJet needles. You can see 0.6. The first trick that you have to understand is that you have to follow the blue line in order to insert very in the good way properly in the skin. I'm starting the procedure now after a little bit of disinfection, and you can go continuously. With this needle that are very superficial, you have less risk of bruising. You can see the little drop here is the material, very superficial, and continues to do the full face treatment. So at the end of half cheek, you can see the little drop, very superficial, of PRP inserted through the MicronJet needle.
Okay.
Welcome to my office.
And now with the polynucleotides, another.
Welcome to my office. Today we are going to have a patient with a request that is difficult to solve if you don't have the right materials and the right needles. She would like to improve the barcode and the eyelid zone. In this area, if you want to do biorevitalization, you should work with the very liquid materials, but we have chosen polynucleotides. And also with very thin needles, because you have to go in the right places. So we choose for this the nano MicronJets needles 0.6. To start with the barcode, and you can see that it's important to see this blue bar, that it's going to guide you to insert the needle. We are starting, and with a little pressure, you see the blanching is the white is the insertion of the polynucleotide in the very superficial part of the skin. Here is the treatment, no browsing at all. You should press a little bit and go at 45 degrees to correctly insert. You see the 3 points. Now you can see the peribuccal distribution, very superficial, of the polynucleotides. It's very difficult to create a regeneration of the lower eyelid. So the idea is to use these very liquid materials as PRP, or in this case polynucleotides. And with this needle, I'm going to get inside the superficial part of the skin. Remember the blue is going to guide you 45 degrees, and you enter in the skin. And you produce very superficial insertion of the polynucleotides. As you can see, very good result, no browsing, no hematoma, and very easy. You can do it even in the upper eyelid very easily. This bubble will disappear very quickly in 1 hour, and I go in the other eyelid. The treatment is already done. You can see all the little bubbles around the eyes. This is a treatment in a very tricky area with the polynucleotides. She has to repeat this treatment 3 times every 1 month, and she will have the improvement of the area 2 months after the last treatment. That's why it's important to use the proper product and the proper needle, because after this bubble will go away in 1 hour or 2 hours, no browsing, no downtime, and so she will have no problem after the treatment, and so she can do her normal daily activities.
Okay, well, so we are going to conclude. So the fillers, for sure, they still have a big role in the cosmetic market, but You have to think about hybrid strategies, a combination of different strategies. I think it's important to educate the patient. That's why you have to work on that, because are complaining there are some problem of communication, and the patient wants results, but also they want to know what they are doing. And I finish. If you want to follow me to my Instagram or things like that, you will see that all my posts will be closed with this sentence, because I want that the patient participate as much as they can to our information campaigns in order to be satisfied at the end. Also, it's important to manage the pain. So if tomorrow something more will come in the market for pain control, for sure I will want the first doctor to try to understand how it works, because I think that pain, manage of the pain is the key for the patient to come to your office. And also you have to prepare some strategies. As you can see, as you have seen in the video, you have seen that I have a pen in my hand with PRP, for instance. To use it, it's a strategy that I use to reduce the pain as I can. So this delivery system, I think, is a new tool that I have in my hand. It's my decision-making protocol is inside for this kind of situation. These are my contacts. Thank you very much. And I don't know if there are questions. We are going to answer to everything.
Thank you very much, Dr. Bollero, for the inspiring lecture. Our time is almost up, but there are some questions, so I will ask. I pick some of them, and we will be happy to have your answers. So the first one is, can the MicronJet be used for superficial injection of diluted superficial Botox for skin smoothing?
Yes, that's the paper of Dr. Diaspro. I think that you can read it easily, or if you cannot find, you can ask to the company, they will send you. And Dr. Diaspro clearly demonstrated that if you want to do the microbotox, that is I remember, that's why I'm old, the waffle wool strategy of microbotox, so not deep, but very superficial, you can use easily with these needles.
Thank you. Another question, how long the blebs stay in the face with PRP?
How long?
How long the blebs, you know, the small...
Yeah, I say to the patient that they have to wait 24 hours.
24.
But they want to stay large, okay? Because it's you know, it's a liquid material and could disappear more quickly. But I say then 24 hours, because when you give any suggestion to the patient, I think you put 5 or 6 hours more than normally in order to be sure that you are not a liar, or they don't consider you like a liar.
Yes. Can I inject with MicronJet also on the neck area?
Yes, I've just put an invitation video this morning that you can find on my social media, in which there is a patient that I've done polynucleotides of the neck easily, because, you know, in some area with this intradermal delivery device, you can easily have the open of the division of the skin, no? So the blister come very quickly, no? And the neck, the eyelid are very easy to treat, because the skin is loose, and so you can easily inject.
Thank you. Okay, do you need to change device during the treatment? It means how many, if you need several devices during one treatment, or?
This is a very interesting question, because I think this is important in order to manage. And you know, when you are a starter, okay, you have to believe. When I started, I have to believe. I can give you my experience, and I can give the same blister, the same little blister after all the treatment of the face of the neck. So I never change the needle.
Okay.
The
What
needle.
yes, the intradermal delivery device, we call it. Thank you. So what are the top 3 benefits you see with intradermal delivery with the MicronJet?
First of all, is for me the idea to reduce the browsing. First of all, because in this way you reduce dramatically every situation. I don't know what are the group of your patients, but my patients are becoming older and older, and so they want the treatment and they have some anticoagulants, so it's important to have a strategy. Second one, you can use it easily for all the liquid situation, and I think it's important and you can use with the pen as with PRP, with the syringe. So it's very versatile. It's use. And the third that I think is also important, the communication, because you are creating a new communication with the patient. The idea is that, are you using the needle? No, I stop to you. I don't use the needle for you. Okay, I'm going to give you another tool that is not a needle. Okay, and this is the way of communication that I think that the company was able to work on the intradermal delivery, not working on the needle. But we have also, as a doctor, in our part of communication, stress on that, because we are not using a needle, but you are using something that helps you to transfer the liquid solution in the skin.
Okay. There are 3 more questions before we finish. Can it deliver PRF or it too thick? PRF, it's good for the MicronJet?
Yeah, yes. So my presentation was very big. So Ronnie cut me a little bit, in which one of the slides was the difference of PRP, because it's like when you speak, say I do PRP, no, I do PRG, I do, so more or less I the same word for something that can create regeneration. So if you change the name, it's still something for your body that can give you growth factors, and that's why if it's liquid, it can pass through. For sure, it's not possible to use the PRP gel. For instance, for the dentist, they use the gel for the senum and things like that. But for all the liquid stuff, you can use it.
Okay. Another question, what kind of syringe do you use to inject PRP?
Yes, so PRP, we use a little machine, okay, with a 3 ml syringe, Luer lock. We like to use, particularly in my office, I'm here in my office in Torino, we use mainly Luer lock syringe and little syringe because, first of all, Luer lock permit you to have to be safe instead of the other in which the needle can go out too much pressure. And then you have to use small syringe because we were speaking about the tiring of injection during the injection. If you use 10 ml syringe, you have to put a lot of pressure to for the exit of the liquid, and so 1 millimeter, 2 millimeter, 3 millimeter syringe are the right syringe to use.
And last question, have you treated the scars with MicronJet and with which materials?
Scars?
Scars, keloid
Yeah.
scars, or
Yeah,
any
scar.
other
Okay,
scars.
okay. Scar is one of my big theme. So the idea that it's difficult to answer scar in general, but if you're speaking about acne scar, perfect. And you can use PRP. We have protocol for acne scar. I have written a chapter of the book of regenerative medicine with Dr. Amin from Springer about my vampire scar treatment in which I use a protocol with PRP for scar, acne scar. For a big scar, you can even think to use it for corticosteroids superficial injection. This is also important because you can give this when you have a scar. It's very difficult to do injection of a corticosteroid because normally when you have big scars, normally you go below the dermis, no, because the scar is hard to infiltrate. Instead, with this needle, you can go the superficial part. There is a little possibility to create some space in the in the scar, but very superficial because and delivery corticosteroids.
Okay, so thank you very much, Dr. Bollero, for your time. Thank you, everyone. I hope that you enjoyed this lecture, and I will share now the details if you want to contact us or look at our website. And I hope to see you next time. Thank you.
Thank you very much to everyone. I've seen there are a lot of questions so you can send me directly. I will answer to everyone. There is no problem. We have a time. The time is finished. So thank you.
Thank you very much.